Okay, so 4.6, we're going to talk about after those nutrients are absorbed, how do they get to other regions of our bodies? And so again, nutrients absorbed in the small intestine, by those epithelial absorptive cells of the microvilli, they're going to be delivered to one of the two circulatory systems. So your cardiovascular system or your lymphatic system, eventually entering the cardiovascular system. It depends on the solubility of the nutrient that we're talking about. So if it's a water soluble, it's going to enter directly into the cardiovascular system. If it's fat soluble, it's going to enter into the lymphatic system. And so let's talk about the differences here. So let's start with the cardiovascular system. So the cardiovascular system is going to be made up of your heart, as well as blood vessels, which include arteries. Arteries take blood away from the heart. Capillaries, which are small vessels like the ones found inside of the microvilli, underneath the epithelial cells of the villi that line the inside of the small intestine, we just saw in the last video. And then veins. Veins are going to take blood back to the heart. And then we have the blood itself. Okay, so those are going to be the components of the cardiovascular system. So like I said, water-soluble nutrients are going to be transported by the cardiovascular system. Okay, transported all around the body by the cardiovascular system. So what are some water-soluble nutrients? Proteins, carbohydrates, many vitamins, so B vitamins, C vitamins, all those water-soluble vitamins, as well as short and medium chain fatty acids. Okay, all of those are going to be water soluble. Okay, again, these water soluble nutrients, they're going to be absorbed directly into capillary beds, which sit underneath the epithelial layer inside those villi of the small intestine. What happens after these nutrients are absorbed into these capillary beds? They're going to be transported to the liver via what's called the hepatic portal vein system. So nutrients are going to go from the small intestine to the liver. In the liver, some of these nutrients will be metabolized, broken down. Some will be stored, so especially proteins, lipids, glucose, and several vitamins and minerals. And then nutrients will get pushed out, sent out into circulation. When that happens, those nutrients are going to be delivered to the cells and tissues all around your body to be used. Okay, so let's talk about fat soluble. So we've got the lymphatic system here. The lymphatic system is going to contain this substance called lymph, and that's going to flow through lymphatic vessels. Okay. The lymphatic system provides an alternate route to the bloodstream. It's going to eventually dumps into the bloodstream, but larger molecules that are not water soluble, that can't be absorbed in capillary beds, this is how they get into the bloodstream. So what does this include? Most fats, fat soluble proteins, vitamins, vitamin A, D, E, and K, and then some larger proteins that can't go right into the cardiovascular system. There are vessels called lacteals. These are lymphatic vessels. We saw in the picture, I believe they were blue, right? We had capillary beds, and then we had the lymphatic vessels. Again, same region. So underneath the epithelial cells inside of those villi, right there in the small intestine. These lacteals will again pick up these fat-soluble compounds and then transport those substances into something called the thoracic duct, which will eventually lead to the left subclavian vein, which is part of the cardiovascular system. So again, eventually these substances make it into the bloodstream. They just don't follow the same route. They're not going to the liver first. Nutrients, after they make it into your bloodstream, again, they're going to be transported throughout your body. So in this figure, there's a lot going on. So this shows it shows the cardiovascular system, right? It shows some of the lymphatic system. It shows a little bit of the respiratory system, and it actually shows a little bit of your renal system because the kidneys are on there. I want to focus here. So here is your small intestine, so digestive system's on here too, I guess. So again, this is where digestion is taking place and absorption. And so absorption, if it is water soluble, those molecules will end up here. So this is, again, nutrient-rich blood, venous blood, is going to travel from the small intestines to the liver. Okay? If we wanted to get really specific, this is the, where's my pointer? The hepatic portal vein system. Okay, again, leading to the liver. Once in the liver, the nutrients are either going to be metabolized, stored, or sent out into the cardiovascular system to circulate throughout the body. On the flip side, fat-soluble molecules, like fats and fat-soluble vitamins and large proteins, they're going to leave the intestines, again, get absorbed, but instead of entering into the bloodstream directly and going to the liver, they're going to be picked up by lacteals and travel through the lymphatic system, eventually entering into the cardiovascular system. Okay, so just a slightly different pathway depending on whether the nutrients are water or fat soluble. In both cases, nutrients eventually make their way into the bloodstream. Okay, so after food, any food that's not absorbed, it's going to make its way into the large intestine. So that's our last stop on our journey through the GI tract. So again, the small intestine is going to digest and absorb, 95% of nutrients. About 5% of nutrients escape absorption, and they're going to enter into the large intestine. And so the small intestine empties into the large intestine through, you guessed it, a sphincter, which in this case is called the ileocecal valve, which again, it's a sphincter, but we call it a valve here. So again, 5% of food that's not digested or absorbed gets in here, plus water, some minerals, and fiber, which cannot be digested. The large intestine is going to be larger in diameter than the small intestine. So the diameter of the large intestines is 2.5 inches, as opposed to 1 inch. The length, however, is much shorter. It's about 5 feet long as opposed to, almost 10 feet long. There are 3 parts of the large intestine: the colon, the rectum, and the anus. The colon is the largest part. It's composed of 4 sections. The cecum, which is the very beginning of the colon, and then we have the ascending, which goes up colon, the transverse, which goes across, and then the descending colon, which then enters into what's called the sigmoid colon. Okay, here's a picture of those right here. Okay, so again, large intestine. The small intestine would be in this area here. We're not showing it. Here is the end part of the small intestine, the ileum. That's going to, contents are going to move from here into the cecum, the beginning of the large intestine, through the ileocecal valve. So there's a valve right here separating the small from the large intestine. Okay. The large intestine, again, starts at the cecum, and then we go up here. This is called the ascending colon. And then we have the transverse colon, and then we have the descending colon. Okay, the descending colon then ends in the sigmoid colon. Okay, so there's, did I say 4 parts? There's 1, 2, 3, 4, there's 5 parts. Okay, make sure I get my math right. So the cecum is the beginning, ascending goes up, transverse goes over, descending goes down, and it ends in the sigmoid colon. Here is the rectum. And then down here is the anal canal and the anus. And there is a sphincter here again, the anal sphincter, which again is the only sphincter that's under voluntary control. Okay, what's the job of the large intestine? If it's not involved in much absorption, some things are absorbed, but it's not involved too much in absorption, and it's not involved in digestion at all. What happens here? So again, a little bit of digestion, I'll start there. So some water and electrolytes like sodium and potassium do get absorbed here. The large intestine does contain what's called the microbiota. It houses a boatload of microorganisms, okay, a lot of bacteria. These microorganisms, these bacteria, are there to keep you healthy. They are a needed symbiotic relationship. We need them, they need us. We'll talk more about that on the next slide, but lastly, your large intestine forms and expels feces. So you get rid of all that undigested stuff. So let's talk about the gut microbiota. This is part of your microbiome, which is your complete flora, your complete bacterial symbiotic flora of your body. More than 100 trillion microbes, mostly bacteria, live in us, in our gut, mostly in the large intestine. We do have some in our mouth, stomach, and small intestine, but again, the majority are going to be living in our large intestine. The number of bacteria found here is 10 times the number of cells in the human body. I mentioned that in an earlier video as well. It's kind of interesting to think that you have more bacteria in and on you than you do cells that make up your body. It's kind of amazing. If we were to collectively, bring all of the microbes together, they would weigh about as much as the human brain. So they make up a large portion of us. The ileocecal valve, just to mention this again, this is the valve that separates the small and large intestine. Its job is to prevent bacteria from moving from the large intestine into the small intestine. Okay, we want to keep them where they are. Again, many of the bacteria here are beneficial. We want them. We have a symbiotic relationship with them. Anytime you take antibiotics, or if you have radiation, surgery, there are a number of diseases, you can reduce the number of bacteria, you can reduce your microbiota. This disruption of this normal balance of beneficial bacteria can be really bad. It's called dysbiosis. It makes room for pathogenic, harmful bacteria to get in there and to cause harm. Okay, so having a good, healthy microbiota is really important. Beneficial bacteria, again, they can protect us against pathogenic bacteria. They also synthesize vitamin K and biotin, which can be absorbed in the colon. They aid in lactose digestion. They ferment fibers and starches. This fermentation process creates short-chain fatty acids that can then be absorbed. They also can be used as an energy source in the colon. As a byproduct of these microbes doing metabolism, there is gas production, okay, which is not a positive. And then they modulate inflammation. And so in this picture here, these are all the things that can affect our microbiota or that the microbiota can also affect. And so things like smoking can have a negative impact on our microbiota. Our diet, so having a low-fat, plant-based diet, high in fermented foods and pre- and probiotics would be beneficial. Alcohol intake, bad. Bad for the microbiota. Genetics, it depends on what your genetics are. Sex, aging, exercise, where you live, whether you take antibiotics or other medications, all of those things can affect the health of your gut microbiome. Inflammation and infection can go both ways. Chronic diseases like GI disorders, food allergies, diabetes, obesity. Chronic diseases can affect the microbiota, and the microbiota can also affect those chronic diseases. Okay, metabolism, immune system, same thing. Okay, so I'm going to briefly mention pro and prebiotics. Prebiotics, so pre meaning before. Prebiotics, ooh, did I skip a slide? Yeah, okay, sorry. Consuming these things called pro and prebiotics can help us to maintain a healthy balance of gut microbiota, intestinal bacteria. Probiotics, we'll do these first. So pro meaning before. Probiotics are going to be live microorganisms that we introduce to our large intestine, and they can colonize the large intestine. Microorganisms, these probiotics are found in fermented foods like yogurt, kefir, and miso. You can also take probiotics in supplement form. They are thought to prevent diarrhea, food allergies, IBS, and IBD. We're going to talk about both of those, actually all four of those in the later part here. Much more research is needed on probiotics. Yeah, I'll leave it at that. There's supplements that, there's a huge cost range. There's a huge numbers range. How many live bacteria are found in the probiotic. Is it a gimmick? Is it, are they taking your money? There's a lot of questions around probiotics. Okay, especially supplemental probiotics, I should say. Prebiotics. These are non-digestible food ingredients that are thought to promote the growth of beneficial bacteria. They can be found in foods like chicory, wheat, onions, garlic, asparagus, bananas, unprocessed whole grains, seeds, legumes, unripe fruit, pastas, potatoes, rice. More research is also needed here. But again, we're starting to understand the gut microbiome more and more. Okay, so we know that the gut microbiota lives in our intestine. We know that it's plays a role in many things. Many things affect the gut microbiota, and there are foods that we can eat to increase the numbers and to increase the amount of beneficial bacteria. So let's move on to absorption. So again, water and electrolytes will be absorbed here. The GI tract receives about a total of 10 liters of water per day. Most of that water is absorbed in the small intestine, so about 90% of it. The large intestine is going to be responsible for absorbing the remaining, and about 1% remains in excreted feces. The large intestine is the main site where electrolytes like sodium and potassium are absorbed. Also vitamins like vitamin K and biotin, they're absorbed there as well. Okay, elimination of feces. So a semi-solid mass will be formed in the large intestine. It's going to remain there until peristaltic waves and mass movements push it into the rectum. Once the feces is in the rectum, it's going to cause this stimulation for defecation. It's the relaxation of the internal and external sphincters. And the anal sphincter, again, is under voluntary control. So you can control when that opens to allow feces to leave the body. Okay. Feces is about 75% water, 25% solids. In the solids, you have undigestible plant fibers, connective tissue from animal foods that can't be broken down, and then, of course, there will be bacteria from the large intestines. Okay, on to the last part of this chapter. We are going to talk about when digestive processes go awry, and this is our list of conditions, diseases that we're going to talk about. Okay, so the first one I want to talk about, myself, we've already introduced it. So heartburn and gastroesophageal reflux disease, which is GERD. Okay, it is the most diagnosed GI disorder in adults. Heartburn is going to occur when that acidic stomach contents backflows up into the esophagus. So again, that lower esophageal sphincter is not working properly. That's going to create a burning sensation in the esophagus and a sour taste in the back of your mouth. If it happens 2 or more times per week, that's going to signal GERD. And so GERD is an actual disease where heartburn is, you might get heartburn once in a while. Again, it's a problem with that esophageal sphincter. That sphincter is for some reason allowing backflow of the stomach contents into the esophagus. Symptoms of GERD include heartburn, hoarseness, trouble swallowing, coughing, gagging, and nausea. You can end up with serious complications from GERD, weight loss, esophageal ulceration, narrowing of the esophagus, bleeding of the esophagus, which can lead to anemia, low iron because you're bleeding. And then there's also a risk of adenosarcoma, which is a cancer of the esophagus. So very serious. Is diagnosed with endoscopy. And so endoscopy is where a doctor, a GI doctor, will go down into the esophagus with a camera and look for signs of GERD. The cause of GERD is unknown, but there are contributing factors. Individuals may have what's called a hiatal hernia. This is the protrusion of the stomach through the diaphragm and into the chest cavity. That may be a contributing factor. Alcohol use, being overweight, smoking, certain medications, pregnancy, eating large meals, some foods like citrus fruit, chocolate, caffeine, fatty fried foods, sometimes garlic, onion, spicy foods, tomato-based foods. They're all going to contribute to symptoms. And then high levels of stress, anxiety, depression, those can all be factors. But again, the initial cause, is unknown. These are just contributing factors. Jumping ahead. Okay, how do we treat heartburn and GERD? It can be treated with lifestyle modifications, and there are medications as well. Some of the medications to treat GERD could have potentially detrimental long-term side effects, but there's a risk payoff. It's getting relief from GERD, might be worth the chance of getting such and such, down the line. Not taking medication could lead to adenosarcoma. So, there's a risk benefit there. Some lifestyle changes that can be made, managing stress and anxiety, which is easier said than done. Eating smaller, more frequent meals, that's going to put less pressure on that lower esophageal sphincter. Okay, avoiding trigger foods and beverages, so those that were listed previously, spicy foods, chocolate, caffeinated beverages, citrus, fatty, fried foods, tomato-based foods, those that we just mentioned. Don't lay down after eating, stay in the upright position. That's going to aid in, just based on gravity, the movement of food down instead of coming back up. If an individual is overweight or obese, weight loss would also relieve some of that pressure on the esophageal sphincter. Smoking weakens the esophageal sphincter, so quitting smoking, could prevent that. Limit alcohol intake. Alcohol causes the esophageal sphincter to relax, which again can cause that backflow to happen. And so limiting alcohol could be a benefit as well. Okay, so that's heartburn and GERD. We're on to ulcers, which we also kind of already mentioned previously, but we'll talk about it again. We only mentioned one cause and there's two causes. So ulcers are small erosions on the top layer of cells in the stomach or the duodenum. Okay, these are called peptic ulcers. Two main causes. One we talked about, so heavy use of non-steroidal anti-inflammatory medications, so aspirin, Advil, ibuprofen. Those again are going to inhibit prostaglandin production, which then inhibits mucus production. So now your stomach or your small intestine doesn't have this mucus coating, and therefore the hydrochloric acid is just going to eat right through it. Okay, so there's one cause. And the second is actually a bacterial infection, which is the bacteria Helicobacter pylori is the second main cause of stomach ulcers. Symptoms: gnawing or burning pain in the stomach between meals, nausea, vomiting, loss of appetite, loss of weight. Okay, complications: bleeding, which again could lead to anemia. Anytime you're losing blood, it can lead to anemia. Perforation of the stomach or intestinal wall. So an ulcer from the acid can actually eat right through that wall. That could lead to chyme, that acidic food mixed with stomach juices, could escape and enter the abdomen. That could lead to infection. That could also lead to death. Okay, that could be very serious. Treatment: we can treat individuals with antibiotics if they're infected with Helicobacter pylori, so if it's a bacterial infection causing this. We can also give people proton pump inhibitors to suppress acid production. It's also recommended that individuals stop smoking and avoid foods that increase any of these ulcer symptoms. Okay. And so here we go. Recommendations to prevent ulcers and heartburn. Again, stop smoking, avoid large doses of any aspirin or ibuprofen, limit the intake of coffee, caffeinated beverages, alcohol, limit spicy foods, eat smaller meals, chew foods very well, lose weight if you're overweight. Okay, all those are for ulcers. Heartburn, follow the previously mentioned, and then also waiting before lying down, not overeating, elevate the head, all those things that we mentioned. Okay, on to the next one. This actually went through a name change. It used to be called something else. So metabolic dysfunction associated steatotic liver disease. That was my dog growling, sorry. So this is a disease in which the liver stores excess fat, so you end up with fatty liver. It may cause liver swelling, inflammation, and scarring. Symptoms, if they're present, include fatigue, nausea, lack of appetite, weight loss, jaundice, pain under the rib cage. This can be diagnosed with a blood test. It's common in people who eat diets that are high in saturated fats and sugar. It can lead to cirrhosis of the liver, liver cancer, liver failure. Treatment: lifestyle. So, a diet that's not high in saturated fats and sugar, and weight loss. Okay, gallstones. So we talked about the gallbladder already. Gallstones can develop in the gallbladder. These develop when cholesterol and bile form crystal-like particles. They can vary in size. They can be as tiny as a speck of dust, or they can be large. It varies case to case. The formation of these, and so these are the gallstones here. And these are pretty big. The formation of these will lead to slow gallbladder motility, slow bile composition, slow release of bile. Okay, all big problems. Why do you get gallstones? There's many different reasons. Sometimes just from being overweight and obese, sometimes from prolonged fasting, rapid weight loss, a diet that's high in calories and low in fiber. Other diseases are associated with higher risk of gallstone, like type 2 diabetes, IBD, cystic fibrosis, having a sedentary lifestyle, some medications, especially some hormone replacement therapies and birth control. Females tend to get gallstones more, pregnancy, people over the age of 60, having a family history of gallstones, and then there are certain ethnicities that are more prone. Okay. Most individuals that have gallstones don't even know it, but if they do have symptoms, this is the list. So intermittent pain in the right upper abdomen, which is right where your gallbladder is, or pain between the shoulder blades or near the right shoulder. Nausea, vomiting, gas, bloating. Gallstone attacks occur when the stone blocks the bile duct, which is going to prevent the flow of bile from the gallbladder to the small intestine. Treatment, surgical removal of the gallbladder. And again, you can live without a gallbladder. The common bile duct will just go from the liver to the small intestine without a stop at the gallbladder. Okay, on to the next one. So food intolerances, different from food allergies. Okay, these do not involve the immune system. Some people are intolerant to some foods, meaning that they just can't digest certain food components. What is this caused by? Well, they might lack the enzyme needed to do the digestion. So for example, if you are lactose intolerant, you lack the enzyme called lactase. Lactase breaks down lactose. If you don't have it, you can't digest it. Some people have food are sensitive to food components such as gluten. Okay, celiac disease is different. We're going to talk about that in a minute. But there are people who are just gluten intolerant. It doesn't involve the immune system. They just can't tolerate gluten. They can't digest it. Synthetic compounds such as coloring agents, sulfites, and MSG, preservatives. Some people are intolerant to it. Residues of medication or chemicals used in food production, and sometimes toxic contaminants. Some people have intolerances. Symptoms vary widely. Okay, let's talk about celiac disease. So celiac disease is an autoimmune response to gluten. It's not a gluten intolerance. It's an autoimmune response to gluten proteins found in wheat and related grains. Anytime an individual with celiac disease ingests gluten protein, so if they're eating wheat or some related grain that has gluten, their immune systems get triggered. And so that causes them to, these immune products that are released are going to damage the villi of the small intestines, okay? Which leads to a decrease in nutrient absorption and then therefore malnutrition. So if we look over here, this is a healthy epithelial layer of the small intestine. You can see all these finger-like projections, right? These are the villi. People who have celiac, anytime they ingest gluten, these get attacked, and you end up with this really flat, no microvilli, blunted villi. And so therefore, again, digestion and absorption are going to be decreased. We're not positive why people with celiac disease develop this. It's an autoimmune disease. It's believed that there could be a genetic component, and it's also believed that there could be some kind of an immunological component. But again, we're not positive. Symptoms of celiac: gas, bloating, diarrhea, constipation, abdominal pain, weight loss or gain, anemia, early bone disease, fatigue, slower growth in children, neurological conditions, skin conditions, infertility. So a whole slew of symptoms. How do we diagnose it? There is a blood test, and we can do a biopsy of the small intestine. Treatment: avoid gluten. That's what we have right now. Okay. Again, that's different from a gluten intolerance. So a gluten intolerance we call non-celiac sensitivity to gluten. Symptoms are similar, but the main difference is if we take a biopsy of the small intestine, there is no damage. Okay. This condition is not well understood. It is not autoimmune. There's no diagnostic test for it. And again, we need a lot more research here. So aside from having celiac disease or non-celiac gluten sensitivity, there is no reason to eat a gluten-free diet. So, the gluten-free diet is has sometimes been promoted as being healthier than gluten-containing diets, and there is zero evidence in the literature to support this. So there's no scientific evidence here. If you are not gluten intolerant and you do not have celiac disease, there is no reason to avoid gluten. Okay, so don't follow a gluten-free diet, to lose weight. It just doesn't make sense. There's no evidence, to support that individuals should not eat gluten. The gluten-free label is regulated by the FDA, and so in order to have a gluten-free label, they have to have fewer than 20 parts per million of gluten. There still can be trace levels of gluten in gluten-free foods, but again, those levels are not thought to stimulate any kind of a reaction in those individuals. Okay, on to intestinal gas. So we're talking about flatulence. It's a mix of gases: carbon dioxide, oxygen, nitrogen, hydrogen, methane, and sulfur. And it is the sulfur that is responsible for the unpleasant odor. Large quantities of gas can cause bloating and pain. Gas is created from the fermentation of undigested food, carbohydrates, by bacteria in the large intestines. There are enzyme preparations that you can take to help prevent the formation of gas. So maybe you've heard of Beano, or again, if you're lactose intolerant, lactase. Can prevent the formation of this gas. Okay. And here's carbohydrates, a list that can contribute to gas formation. Okay, so raffinose, lactose, fructose, sorbitol, starches, fiber. These can all get digested by bacteria in our large intestine and can lead to gas production. Okay, on to constipation. I'm sure we all know what this is, but constipation is the difficult or infrequent bowel movement. So fewer than 3 times per week is considered to be constipation. This is caused by slow-moving fecal material through the large intestine. And so if we look on the right here at the Bristol stool scale, types 1 and 2, where's my pointer? Types 1 and 2. So type 1, small, hard individual nuggets, hard to pass. Type 2, small, hard nuggets fused together. Again, hard to pass. These would represent constipation. Okay, often reported in older individuals because our colon, as we age, becomes more sluggish. Okay, what's it caused by? Ignoring the normal urge to go to the bathroom can cause constipation. Diabetes, irritable bowel syndrome, depression, pregnancy. There are some medications, and very importantly, a low fiber diet. So fiber is really, really important in a lot of ways. This is one of them. It prevents constipation. Treatment, high fiber diet. You should get between 25 and 38 grams per day as an adult. Drink more fluids. Develop more regular bowel habits. Don't hold it. Relaxation, daily exercises, and if needed, in serious instances, medication. So bulk forming laxatives like Metamucil and Citracel, osmotic laxatives like milk of magnesia, down to, in the very severe cases, an enema might be necessary. Okay, so on the flip side, diarrhea. Diarrhea is going to be loose, watery stool that occurs more than 3 times per day. There are various causes: bacterial, viral infections, parasitic infections, food intolerances, medications. This is important. A mega dose of vitamin C. When we get to the vitamins chapter, you'll actually do a little case study about this, so keep this in the back of your mind. Having way too much vitamin C, even though it's water soluble, it can lead to diarrhea. Intestinal disease and irritable bowel syndrome can also cause diarrhea. Okay, let me move myself. So here's that Bristol stool scale again. So types 6 and 7, okay, would represent diarrhea. A complication that can come from having diarrhea is dehydration. So you lose a lot of water and electrolytes, and so the treatment is to drink more fluids and replace those lost electrolytes as well. I don't have a medication listed here for diarrhea, but there are over-the-counter things that you could take. Okay, IBS, irritable bowel syndrome. This is a chronic disorder. It's more common in women. Symptoms: irregular bowel functions, could be diarrhea, could be constipation, abdominal pain, abdominal distension, so sticking out of the abdomen. Symptoms often worsen after eating. The cause is unknown, but we think that stress and diet probably play a role. Treatment, case by case. Sometimes peppermint oil works, causes the relaxation of smooth muscles in the GI tract. Eating a low-fat diet of frequent small meals. Sometimes eating a gluten-free diet. Probiotics, sometimes. Avoiding trigger foods. And lastly, the FODMAP diet protocol is usually what's going to be prescribed here for IBS. What is this? So this is restriction of foods, slow reintroduction of those foods, and as you reintroduce those foods, you figure out what you're sensitive to. And then you end up with a personalized diet. And this should be done under the direction of a health professional. Okay. And then we've got IBD, so inflammatory bowel disease, which is different, from irritable bowel syndrome. This is also a chronic intestinal disease. Ulcerative colitis and Crohn's fall into this category. So ulcerative colitis is inflammation and ulceration of the innermost layer of the intestine, okay, the large intestine. Crohn's is inflammation and ulceration in all of the layers, not just the innermost layer, but all of the layers, and it can be in any part of the GI tract, not just the large intestine. It's most common in the ileum, which is, again, the end part of the small intestine, and the ascending colon, which is the part of the colon that goes up. Okay. What you end up with, again, that inflammation, it's going to cause swelling, scar tissue, and you end up with a narrowing of the GI tract. And so there's not a lot of room for food to move through. Symptoms: rectal bleeding, diarrhea, abdominal pain, weight loss, fever. Okay. Complications: you could end up with nutritional deficiencies because you're not absorbing everything that you need. You could end up with osteoporosis from the lack of minerals and calcium. High risk of colon cancer in individuals who have IBD. Again, the cause is unknown. So, more research is, I keep saying that, more research is needed, more evidence-based research is needed. But we think that an overactive inflammatory response to antigens in the GI tract is the probable cause, which is the probable cause of celiac as well. And there's probably a strong genetic association as well. Treatment: medications, including immunosuppressants. So we're going to suppress the immune system, which could have other effects. And then antibiotics. If it's really bad, surgery to remove the diseased area. Okay. So if you have a large buildup of scar tissue where food can't move through at all, that's the only option. Okay, lastly, hemorrhoids. These are swollen veins of the rectum and the anus caused by pressure on blood vessels in that region due to maybe obesity or prolonged sitting, violent coughing or sneezing. Pregnancy can bring these on, and so can constipation. Symptoms: you can have an itching, pain, bleeding. And treatment: warm, soft compresses, sitting in a hot tub of water, increasing fiber and fluid intake, exercise, and then there are over-the-counter remedies like Preparation H. And then lastly, in severe cases, surgical removal. Okay, so that concludes Chapter 4.